everybody, it's Claire here from Sewn by Claire, and today I'm going to ask you to indulge me because we've got an off-topic conversation that I kind of want to have with you all today. And it's about something that I'm surprised that I'm even talking about on the channel, because it's nothing to do with stitching, although is it? Being as we all have our own coping mechanisms, then actually I'm wondering whether stitching is one of my coping mechanisms. And the subject that I want to talk to you about today is my experience so far of menopause, but more importantly, what's been happening with me since June of this year. So I don't think it's any surprise. I'm nearly 60, I'm not far off, a couple of years to go. And I think I went through menopause around the age, finally, of about 52, I think. And I thought I was coping really, really well. I thought that I had symptoms that were manageable. I didn't think that it had really affected me that much. My mum was the same. And it's just come to light that there was so much about menopause that I had absolutely no idea about. And actually, I feel a little bit cross and a little bit cheated about it. And because the majority of my followers are women and are of a certain age, I think we mainly range from around age 50 or 55 right up to 70, 75 and above. And I just wanted to share a bit with you really, because I don't know whether or not you're experiencing the symptoms or whether you did, but there's a whole load of new information that is being released and on the subject of menopause, and specifically post-menopause, that I thought actually it is relevant to you and I. And you've all been so supportive of me on my channel with your lovely comments and the viewings and the sharings of my videos, that actually we kind of feel like friends now. And if we were meeting face to face, then I'm sure some of the things that I'm going to talk to you about today would come up in a conversation between friends. And so, because there's nearly 4,000 of you now who are subscribers to my channel, and because I feel so strongly about this, then I'm just asking for you to indulge me for a few, I want to say a few minutes, but we know it's going to be more than that. For a short while, I'll try and make it as short as I can, but for a while, whilst I share with you some of the things that I have learnt, in order that you can see whether they're helpful to you, whether it mirrors your own experience, or whether there's new things that I talk to you about and share with you that have come to my attention that might be helpful to you. So just as a sewing technique or a cutting out technique or an easier way to do things might come up in our sew-alongs and our sewing tutorials, then surely things about life are relevant to us too. So we share that common thread of sewing, pun intended. And so, yeah, just bear with me. Go and get a drink. Press pause for a minute or two. Get yourself a drink, maybe a biscuit, or grab your hand stitching. And let me just share with you some of the things that I have found out and see what you think about it too. Okay, I'll pause it here while you go and get a drink. Okay, have you got your drink, got your biscuit, got whatever you want? This conversation is going to be fairly frank, because you can't really talk about menopause and about women's anatomy and what's happening without using some of the correct terms. And so I apologise if that's shocking to anybody. I don't feel shocked by it at all. I don't feel uncomfortable talking about it at all. So I'm going to continue. But I just want to say in advance that I will be using certain words, polite words, the correct terms, hopefully. And I just don't want it to be a shock for you if you're of a delicate disposition, okay? I don't want all of the hate comments coming in. And also the other thing is I'm going to be sharing some very personal details about my journey, but I think it's all relevant in terms of context. But what I'm not looking for any comments on my personal choices, and I'm not wanting any comments on how I've handled my life so far. It's the key learning points and the sharing points that I'm trying to get across. So that's just kind of thing between friends, really, I suppose, just to sort of set that little boundary there, so that it sort of protects me, because I know that the internet and YouTube comments can be fairly anonymous, and so I will be deleting comments if they are disrespectful or they are not on topic or they're too personal. Just to let you know that in advance, just to protect the feed from everybody else and me as well. Okay, so everything for me started to change in June of this year. And for some reason, and I don't quite know what it was because I wasn't searching for anything at all, I started to get a lady called Dr. Kelly Casperson, who is a medical doctor, a medical urologist in the United States of America, coming up on my feed. Now, she's authored a book before called You Are Not Broken. And she's also just got a new one out called The Menopause Moment. And I'm mentioning those because I'm not trying to plug her books, and I do want to get The Menopause Moment, but I've used up my quota for spending on books at the moment. We'll get into that in a minute. But she started to come up on my feed because she's got a very down to earth and a very approachable and friendly manner of talking about this type of thing. It's her work after all, so she's used to talking about lots of things. And what started to happen was that she started to talk about all of the symptoms of menopause that kind of go under the radar, and they all started to sort of hit an alarm bell with me, really, as I was listening and following along. Then another lady came up on my feed called Dr. Mary Claire Haver, Haver. Again, another, I think she's gynecologist, obstetrician in the States as well. So she came up and she was starting to talk about prevention for osteoporosis and dementia, but in the context of how the menopause can start to affect some of these things for us. And it kind of sent me down a bit of a journey, and I started looking at some of their things. They've both got YouTube channels, they've both got Instagram accounts, which is where I got a lot of the information from, and they're both on Facebook, so you can find any of them there. And I'll pop some links down below if you want to go and have a look and see about them later. And for those that I don't know, I don't know where to start. So one of the big things that I've been really suffering in recent years is insomnia, and also getting up in the middle of the night. Now, you'll have heard me chatting, I think, before on some of the videos about being a midnight sower and getting up often between 2 till 4 in the morning and sewing. And it's a huge joke amongst some of my friends as well that don't bother booking anything with Claire before 11 o'clock in the morning because she just won't be up. And I know that's made me feel quite lazy in places, as if I'm doing something wrong and that, I'm just lazing around in bed. But actually, because I was going to bed 11:30, midnight, but then I was up 2 o'clock till maybe 4, maybe even 5 sometimes, because I just couldn't sleep. I'd be lying there in bed, almost drumming my fingers on top of the bed covers, thinking, do I get up? Do I not? Do I have something to eat? Do I make myself a drink? What do I do? And the sleep just wouldn't come. My mind would be racing. In my case, lots of projects and the things that I want to bring to the channel and the things I want to make. But also just life things from years ago would start coming up into my mind. And it was all a bit disconcerting, really, because you kind of think, well, where's that popping up now? I don't understand it, really. And so what I hadn't realised is that, and you may already know this, but I just didn't, is that insomnia and struggle to sleep, difficulty sleeping, either falling off to sleep or staying asleep or staying asleep all night, is one of the huge symptoms of being postmenopausal, perhaps even perimenopausal. I can't talk about perimenopause because that's kind of too long ago for me. But certainly the insomnia over the years has become a real problem for me, because I would wake up really feeling quite fed up and quite down. I'd be quite sluggish in the morning. I'd feel like I was losing half the morning, and that there wasn't anything really, I couldn't really make that time up, because then by the time it got to evening again, I was feeling tired. And so then when it got to evening, I'd want to be settling down and snuggling down rather than getting on with the things that I would have done in the morning had I not been in bed all morning. So it started to really impact onto my life. It was quite a revelation actually to find out that this was one of those things. The other thing that had been causing me some concern, and very personal concern, is that again, over a similar period of time, my libido's just dropped off the floor really. And I'm in a happily married woman, and that's an important part. Intimacy is an important part of a relationship, and that was causing me some concerns, and it was hard to try and balance that against loving my husband and wanting to kiss and cuddle, but then not having really any interest in sex at all. And coupled with that, I found that I was losing a lot of my sexual feeling as well, and that the sensations were missing, or starting to miss, and then finally did go to altogether not so long ago. And that was really upsetting to me and really concerning. And so when I heard Dr. Casperson particularly, who's a urologist, talk about, she calls it vaginal atrophy, then I was like, well, what's that? So I started to look into it, and with her help as well, then I could kind of see what was happening and see what was being talked about. And basically it's recognised that during menopause and post-menopause, that the changes in your body due to the estrogen that drops off a cliff basically when you go through menopause and then become postmenopausal, that has a huge impact on all of the major organs in the body, but also on your vagina, and also on your sensations, on the tissues down there, on your clitoris and on the labia, and all that total area. Now, a lot of ladies also experience a lot of urinary tract infections as well, or UTIs, and that they can be really debilitating for some people with either repeated antibiotics, which then take their toll on your system, or that you can eventually develop an immunity to. And whilst I hadn't got the UTIs, I didn't really have the water infections, certainly a lot of the other symptoms that they were talking about, I was experiencing. So that then, so we've got the insomnia, then we've got the loss of libido, then we've got the loss of sensations, that all started to pull together. And then also, since I've moved to Spain really, which is nearly coming up to 7 years now, about 2 years after we moved over here, I'd lapsed with a dentist in the UK, and then I needed to start again over here. It is relevant, bear with me. And when I went for the checkup before I came away from the UK, I'd noticed that I'd got some oral changes as well. So I'd noticed that quite a lot of the time I used to have bad breath, which was really embarrassing for me and really uncomfortable. I started to get really conscious of it, so I didn't go anywhere without any chewing gum or mints in my bag. And I certainly found that I was standing further back from people while I was talking. Around that time as well, I also found out about something called tonsil stones, which I unfortunately do have. And then when I went to the dentist over here after about a 2 to 3 year, maybe 4 year lapse in going to see the dentist in the UK, and I'd always been fine going to the dentist. Every year or so I was going to the dentist, and I always brushed my teeth every day. You know, my oral hygiene I thought was pretty good. Then when I went to the dentist here for the first time, she told me that I needed 5 fillings. And that was a lot for me, because I've got a fear of dentists, as we know, and I've had some dental surgery, as you know, this last year. So that then sort of came into play, because then there was somebody else I follow on Instagram, and he's called Ask the Dentist. I know it's a bit of a weird name, but he's a dentist again. I think he's in America. A lot of them is in America. But that's the beauty of the internet, isn't it? We just can see people from all over. And so he started to say about menopause as well. And I'm thinking, what's going off with my social media feed? We've got all of this menopause just exploding all over it. And I've not even been looking at anything, or hadn't at this point. And then he started to speak about how you can start to get a dry mouth and throat in menopause or postmenopause. And I've been getting a dry throat at night time with a recurrent cough. And I thought I was getting some silent reflux. I thought it was perhaps that was causing the problems in my throat. But he also cited increased cavities, bad breath. He also cited things like gingivitis and because of the change of the oral microbiome in your mouth as well, but also tonsil stones associated with that. And he lumped those all together as being symptomatic of the change of the mucous membranes in your mouth, changing the pH balance and changing your microbiome, all to do with menopause again. So then all of these things start creeping out the woodwork. And then I see from, I think it was from Dr. Mary Claire Haver, she started to say that you can get tinnitus from menopause, tick, and also vertigo, tick as well. And I've had vertigo on and off for many years. And I've tried to avoid things that I think set it off, stress, high inflammatory diet, that kind of thing. But you get to a point where you can, especially with the insomnia, where you can only cut out so many things. So I was trying to cut out sugar before I went to bed. I was trying to cut out TV before I went to bed and electronics. I was wearing blue light glasses. I wasn't drinking alcohol because white wine keeps me up, so I thought that was bad. Sugar kept me up as well. I was trying not to go to bed too early but not too late either. I was trying to exercise in the day so that at least I could go to bed tired, but even if I went to bed tired, I still wasn't falling asleep. And so what started to dawn on me was that actually I was living with a lot of symptoms of being post-menopause that were actually quite impacting my life, and I'd just not realised that they were connected at all. I thought my oral issues were, I don't know, maybe I'd not been looking after my teeth properly or not been as diligent with my flossing, or, you know, that the white wine keeping me up was something to avoid and then I'd be fine and I'd go to sleep, but I wasn't. And so this is where it all started to come together. So anyway, what's happened is, and what's happened with the information that I found, let's do one thing first. So if any of this is ringing true or not, you can go onto a place called, let me just show you the address down the bottom here. Oops, can't that's it. I'll put it in the comments for you as well. menopausesupport.co.uk. And what they have is they have 2 checklists that you can find under the free resources. One is a menopause checklist, a menopause symptom checklist. It doesn't include everything, so just bear that in mind, but I'll expand on some of that. And then there's what's called a genitourinary symptom of menopause checklist as well. That's for all the UTI and all the vagina issues and what have you, all the issues down below that you can have, because there's actually a lot that can be done, and I've actually found some solutions that have come out through the information that I've found. So bear with me because we'll get onto that. So what I did was I actually went along to the menopause checklist and I filled it out. Let me just go through the list with you. So anxiety, low mood, and I've seen that described, oh no, it's further down on here. Mood swings, irritability, which can just be snappiness, tearful, lack of motivation, and I've been struggling with procrastination quite a lot recently, and again I thought it was just me not being focused. Loss of joy, now that's one of those kind of non-specific symptoms, but actually that's fairly major, isn't it? Losing the joy in things. I also heard as well that where people have wanted to just sort of take themselves away and have a few days away on their own and not be bothered by anybody else. No husband, no children, no pets, no work, no nothing. Just literally go and sit in a darkened room or a room by yourself in order just to find some sense of self again. And I have actually, although I hadn't told Rob, so don't tell him, but I had actually thought at some stage I'd love to just go and rent a cottage somewhere on my own, take some projects, get in some lovely food, and just take myself off for a few days. And I hadn't realised that that's all totally normal for somebody who's postmenopausal. Anyway, let me carry on. Reduced confidence. Now, reduced confidence as well is an interesting one, because how many of, I'm going to say you guys because it doesn't affect me so much, but a fear of driving to new places or a fear of driving at night time, that all comes under these symptoms of menopause, because we have poor memory, brain fog, poor concentration. So you pull all of that into the mix as well with a bit of difficulty sleeping and being low on your sleep, and suddenly you're getting a perfect storm for not feeling as confident as you used to be when you're driving, because you can't focus in quite the same way. Difficulty sleeping, fatigue, headaches or migraines, heart palpitations. Yeah, I've been getting those and wondering what those were about. Hot flushes. Now, luckily, I didn't have too many hot flushes. However, that's changed. I'm hesitating because I'm trying to think where to put things. But I have started taking a little bit of HRT. And I have found that once I'm asleep, if I can get asleep, then I'm actually staying asleep. Whereas before I used to find that my foot was in and out of the covers, or the covers were on and off. So I was thinking of night sweats as being something where your nightie or your sheets have to be changed because you're sweating through them, or you're waking up and you're just covered in sweat. But actually that inability to control your temperature, possibly in the daytime, but especially at night time, can be really disturbing to your sleep patterns. Another one is joint or muscle pain. And did you know that frozen shoulder is one of the highest, or one of the most common symptoms of menopause as well? I had no idea. I know people who I speak to who've said, oh yeah, I've got my shoulder and I've had to have surgery on it and what have you for that. And I didn't realise that the breakdown in the collagen, or the lack of estrogen in your collagen receptors, then affects all of that. We've then got changes to periods. Well, that didn't matter to me because I've finished years ago. Vaginal symptoms, and then that takes us on to the genitourinary, and the urinary symptoms goes on to there. But loss of libido is down here in the menopause support symptom checker as being one of the main symptoms. Also dry or itchy skin, and sometimes they've described that as feeling like you've got something crawling on yourself, when your skin just feels like you've got a bug on you or something like that, and you go to wipe it off and there's nothing there. Also on dry and itchy ears, another one, skin is another one, is itching ears. Now I've had dry itchy ears as well, not on the outside but actually in the ear canal, where it just seems to just not want to stop itching and clearing, and I've had that as well. Dry ears or eyes or nails. Oral health changes, so this is where I was talking about sudden onset of bad breath and also the dryness in the throat and in your mouth. Thinning or drying of hair. Weight gain, well yeah, I've got that. Feeling dizzy or faint, that's your vertigo. Tinnitus. Restless legs as well. I get restless legs, for which I take magnesium, and I've been taking that before I go to bed. They say also increased allergies and then digestive issues. That can be things like alternating between diarrhea, constipation, that type of thing as well, that can also cause problems. So when I actually went down this list, I actually realised that I was probably, I think there's about 30 things on here. I'm just guessing because I haven't counted them and I don't want to waste your time while I do count it. But there's a number of things on here, and I think that I have ticked the majority of them. Some from severe or distressing to some that are just occasional. But that's a really good starting point, especially if you, after listening to all of this, decide that you want to speak to your doctor and just raise some of those issues with them. Then you can take this along, because it's much quicker for a doctor to read through a checklist like this with a little note at the end than it is for you to find the words when you can tell that they're bored and restless and wanting to get on to the next patient. They can take in the information really quickly. So that's a good list. But all of those things are to do with menopause. Now, the genitourinary symptoms of menopause I want to talk to you about as well, because this is something that was absolutely completely new to me, and it's absolutely blown my mind that I knew absolutely nothing about this at all. So the one that I did know about was vaginal dryness. Now I never had that at all, so I thought, well, it's not affecting me at all. So that is one of the things that you can have. Vaginal or vulval, so vagina is the internal section of your female reproductive parts, and the vulval is the outside area. So vaginal or vulval dryness, vaginal or vulval soreness, irritation, pain, burning, skin thinning or splitting. I have had some of that. Labia shrinking. Who'd have known it? Clitoral shrinkage or pain. I didn't know that was a thing. A watery discharge rather than a slightly thicker, creamier discharge than you might have had when you were younger. It does say a painful episiotomy scar. I did have an episiotomy for my first child, Rebecca, when she was delivered, but I didn't for Lucinda. Abnormal vaginal bleeding, not had any of that. Painful intercourse, nope, didn't have that. Bleeding after intercourse, didn't have that, but these are all the symptoms. Repeated urinary infections, hold on to that one because that's a biggie. Urge urinary incontinence, yep, had that. Laughing too much, coughing or sneezing, picking up something heavy, that was a problem. I just thought that was just what every woman had if she'd had a vaginal delivery for a baby. Stress incontinence is sort of linked into that. Pelvic organ prolapse, and then a painful smear test. So I didn't have quite as many symptoms on there, but the ones that I did have were really quite obvious to me, and I was certainly carrying those symptoms along with me with everyday life really, and just working around them. I perhaps put on a panty liner for if I was going out in case we laughed or coughed or sneezed, you know, and or you used a bit of hydrocortisone cream if you know you got a little bit of soreness down there, that type of thing. But did you know that there is an actual cream called vaginal estrogen cream, which is at a 0.001% strength, so really, really small strength. But if you use this cream, it also comes as a pessary as well, and also as a ring that you can have inserted as well. That it replenishes the estrogen that's lost from that area. It thickens out your vaginal tract, shall we say, but it also restores the pH balance that you need in the vagina in order to keep yourself healthy and away from things like UTIs. So in addition to that, it also helps with reverse the labia shrinking and anything that's going on with the clitoral shrinking. But it also helps to bring back the sensations that are lost, which means that you don't perhaps enjoy being intimate anymore. And I was just like blown away. I had no idea at all that this cream existed. So of course I'm thinking, I need to get myself some of this. It sounds pretty amazing. And actually I've got people in my family who do suffer from repeated UTIs who are just a bit older than me. And I've made sure that they know about it too. And this is why I'm making sure that you know about it as well, because this might be something that you have. And I think that I know that one of my family members has had numerous doses of antibiotics in the last 12 months alone, and is actually struggling to find one that's going to work against these infections. So I've made sure that she knows about it. So I didn't know. Did you know? Is it just me? Am I just living in a dark cave somewhere? Because, yeah, why aren't we told about this? So I feel quite cross really, because I was starting to think, do I not fancy my husband anymore? You know, am I in the right relationship? Is everything okay? What's going wrong? And it isn't any of that at all. It's just menopause and the symptom and the estrogen being lost that's just making a lot of this happen. And I kind of liken it to, and I don't mean any disrespect to anybody who's carrying any ongoing illnesses, but I'm talking about high functioning alcoholics, high functioning autism, high functioning depressives who mask their symptoms and cope with their symptoms in order that they can get through every single day. And after reading some of these things, I kind of realised that that's probably what a lot of us have been doing, is we haven't wanted to make a fuss. We haven't wanted to be moaning. Everything's just kind of a bit wishy-washy, and that we've been blaming ourselves that these things can be happening, when actually it isn't our fault. It's just a hormonal change that we didn't know about. And sometimes things are easier to cope with when you know about them and you know what it is, rather than just thinking you're going a bit crazy in your head or that there's something wrong with you. And I think that's where Dr. Kelly Casperson's book comes in, You Are Not Broken, because she's trying to say it's not you, it is the difference at this stage of life. And all credit to anybody who is happy with carrying their symptoms and working through those, because there's been some more that I've found out as well that means that not only do we not need to worry about the symptoms now, but actually we can get some protection going forward as well. And I'll talk about that as we go through. So I hope you're still with me anyway. I've probably turned off about 90% of my followers by now, but for those of you that I care and love, I do hope that you do stick with me and just see how this all follows through. So following on from the understanding of the symptoms, I then started to come up against a lady who's in America again. She is a little bit alternative. She calls herself Menopause Taylor, and she has a great website. Again, I'll link it all down below for you. But she came out with a a reel on DEXA bone scans, how you can check your bone density. And this was something that I tried to have done at my not my last one, but my one before last, a year and a half ago, my previous gynecological appointment, and I'd said, oh, could I have a bone scan and just see, where I am? And she said, oh no, you don't need one of those yet. We don't do those till you're 65. I'm like, oh, okay then. So I didn't think any of it. I'll wait until I'm 65. Bit of a way to go yet, but never mind. Anyway, this Dr. Taylor, again, who's an obstetrician, that's it, gynecologist, but also a menopause expert. And she had just a one reel, and it was just for 2 minutes. And I'll try and link it down below if I can find it again. And she was talking about what a DEXA bone scan is, what it means for your bones in terms of the density, and then how to understand your score when you get a DEXA bone scan. And she said that a lot of doctors won't even entertain the thought of a DEXA bone scan until you're 65. Well, that was my experience of it. And that a lot of people get dismissed when they ask for one, which I did. But she said you really do need to stress that you would like to have the DEXA bone scan done. And if it means you're paying for it, then pay for it. Now, when I went to my last one, not the one before last, I then asked again if I could have the DEXA bone scan done. And young female doctor, she said, oh, you don't need that, you're not 60. I said, well, I really would like to have it, because again, Dr. Taylor said, you need to push for it, advocate for yourself. So that's what I was doing. So she said, no, you don't need it yet. And anyway, I don't know if your insurance will cover it. So because I'm an expat immigrant into Spain, then we don't access the healthcare system. We have to have private medical insurance as part of our criteria for being here. So I said, well, that's fine. She said, well, I'll have to check for you. So I said, okay, well, that's fine. But I said, but if they say no, don't worry, because I'll pay for it myself. And she went, oh, will you? She was quite surprised, but that wasn't a problem. Anyway, I left it at that, had all of my other stuff done, and we'll come back to the other stuff that I've had done previously. And I'll follow on to that appointment. But this DEXA bone scan, I just want to do it as a bit on its own. So anyway, I didn't hear anything for a couple of weeks, and then we had to go into our other medical clinic, just a different medical centre, to check on something else. And so I asked there while I was there, I said, oh, do you do DEXA bone scans? They said yes. And I said, oh, well, how much is it? She said, well, your insurance will cover it. I said, oh, well, I've been told that it might not do, so I was wondering how much they are. So she said it was €90. So that's not that horrendous, is it? Well, that's probably about 75, 80 pounds maybe in sterling. I think something roughly about that. So it wasn't a deal breaker. It went out £300-400. So I said, okay then. So she said, well, if you just see the doctor, then I'm sure he'll allow you. So I went to see the doctor, and he said, and I just said, I'd like to have a DEXA bone scan, please. He said, of course. Wrote out the prescription and said, take that to the receptionist and she'll organise the appointment. I was thinking, that was a bit easy. Anyway, I wasn't going to argue. So I went outside and made the appointment, and then earlier this month I've had my DEXA bone scan. Now, I was expecting, perhaps you know what's coming here, I was expecting that on the scale given by Dr. Taylor, that anything 0 and a positive number is really good, and you're classed as normal, and that's all fine. And then what Dr. Barbara Taylor said was that anything that's 0 and then a minus number, you really need to start paying attention to, because whilst the general medical council or whoever, the medical profession, may say that you're still okay if you're at -1, actually, she said, it needs to be a bit of a wake-up call that things are starting to deteriorate, because the things you can do sooner make a difference. So that was all kind of where we are and what have you. So let me just get my papers for my DEXA scan, won't be a second. Okay, so what I want to show you, without giving away any of my personal details, is my results. Because if you look here, the green is normal, the red is osteoporosis, and look, I'm already on the verge between osteopenia and osteoporosis. That's in my lumbar spine. And then this here, I'm just out of normal and into osteopenia on my hip joints. So, thank goodness I asked for it and had it done, and thank goodness I wasn't refused, because knowledge is power, surely. So that was a bit of a shock, I can assure you, because I've not had any symptoms at all. I don't really get backache particularly, other than just normal if you've done too much. And I certainly haven't had any clues at all that my bone density was starting to fail. But social media is bad in a lot of ways, but in this situation, I am so pleased that I've found that information out, because I can do something about it now. I was already taking vitamin D3, and I take vitamin K2, which is supposed to be the really 2 good ones. And then I was taking a calcium, but I'd stopped because I'd read that it could cause tonsil stones, and of course I've got those. So I was thinking, oh well, I've got too much calcium in my system. Anyway, I need to do further investigation about that. But anyway, so when I went to my let's go back for a bit first. So another thing that I found out through Dr. Kelly Casperson, we'll come back to the osteopenia in a minute, was that what she was saying as well is that in 2002 there was something called the Women's Health Initiative, and that was a big randomised study that was considered to be the gold standard of study, and that the results of which stated, there was a big press conference, and it stated and put out warnings about HRT, hormone replacement therapy, and the fact that it could cause breast cancer, blood clots and heart disease. And so overnight, literally overnight, the number of women taking HRT dropped from 40% down to 18%. Those are the figures from America that Dr. Kelly Casperson was quoting. So basically the demand for it dropped off a cliff overnight because everybody was concerned about the risk of breast cancer. And I think that I can remember this, and bear in mind, I can't remember how old I would have been then, but probably, sort of early 20s, something like that. Then I was just kind of, it wasn't really on my radar. So early 20s, no. My maths is rubbish, it is. Just ignore me. Okay. 2002 the report was, okay, I'm not far, I've got 2 years to go to 60. So you can do the maths. It wasn't on my radar. I heard about it, I thought, oh, that's, and then left it at that. But earlier this year, what's happened is that some more research has been done into that report. And a lot of the findings have actually been turned over. So whereas HRT was deemed as this really bad thing for everybody, literally every woman, then now in certain cases, it's not right for everybody, and I'm certainly not trying to tell everybody to try it, in certain cases, then HRT can not only help you with a lot of this great big list of symptoms that we've got going on, but also it can give you protection against osteoporosis, ding, ding, ding. It can also protect against heart disease, because apparently heart disease is one of the biggest killers of women, not breast cancer. It can also protect against dementia and Alzheimer's, and it can also protect against type 2 diabetes. It can also give, I want to say a high percentage, and I'm going to quote the percentage, but I can't remember the source for this one. So again, I'm not making it up, it is what I've heard, but I've been looking at so much stuff that it's all getting a bit kind of mixed up. There is a 50% reduction in the chance of pancreatic cancer and a 30% reduction in the chance of colon cancer. But also there's a very high protection against macular degeneration as well. They're saying that the optimum time to start HRT, if you wanted to, is in the 10 years post-menopause. And I'm just around about in that range, but I've missed quite a big window of opportunity there because all of this information hadn't come to me then. So I kind of want some of these protections. I also understand that they have found in some cases that it can actually add 3 years onto your lifespan. And there is a difference between lifespan and health span, I get that. But the book that helps me kind of understand it was this one here, which is called Estrogen Matters. And it's by Dr. Arum, Bluming and Carol Tavris, and I'm going to put, where's the ISBN number? It's on the back here. I'll put the ISBN, if you screenshot that, hopefully you should be able to see it. And this book here talks about how life was before that WHI initiative report came out, what's happened during and what he's found out since, because Dr. Arum Bluming is actually a breast cancer specialist. Is he a breast cancer specialist? His wife had breast cancer and he noticed firsthand how she was suffering or the symptoms she was tolerating after having her breast cancer surgery. And so this one is very, very geared towards estrogen and breast cancer and the things that you can do if that's relevant to you. So that's another good book, and that's one I bought this month. So this all sort of started to then have a look through what was happening and with me, and I thought, well, what happens if I could actually get some sleep? That would be fabulous before we even start anything else. I could gain back half a day easily by getting up at 9 o'clock in the morning and feel able to go through a full day, rather than sleeping in till 11 because I'm catching up on the sleep I didn't have in the night time. And whilst it's quite nice to sew in at midnight when it's all quiet and you've got no other demands, actually it does take a toll on your life, and it isn't quite as nice as people might have you think it is. But also some of the other symptoms as well that I was questioning. So the long and the short of it is that I have now started, at the last time I went to my gynae appointment, I have managed to get onto HRT. So I'm taking the lowest dose because a lot of the problem is that a lot of the doctors aren't up to speed on the menopause new research that's coming out, or the new way of thinking that after this WHI report at 2002 was overturned. And so a lot of them are thinking you still need to be on the smallest amount possible for the shortest amount of time, just to cope with hot flushes. Nothing else, there's nothing else that affects us. Excuse me, did you see that list? So yeah, I've got to just find the right person to be able to prescribe what I now know I need to get an optimal dose, because I certainly want to try and address the osteopenia that has started within my body. And I certainly want to try and head it off going to osteoporosis if I can. And that's going to take a combination of lifestyle changes, some time in the gym as well, in order to do some weight bearing exercises and to do some impact as well. They say some form of jumping, so you shock your bones, can help densify those bones up. Densify, is that a word? I don't know. Re-nourish or re-strengthen your bones. Making up my own words now. And so that's what will be happening over the next 20, 30 years of my hopeful life that I've still got left. And yeah, so I wanted to share this with you. So anyway, another book to look at then, if you are in the osteoporosis or you are in the osteopenia list, is this one called Unbreakable by Dr. Vonda Wright. Again, she's on Instagram, Facebook and on YouTube as well, with some very good podcasts, etc. And so that's a good book. Let me just turn it. Oh no, what have I got on here? I got this from Amazon. Hasn't got the ISBN number on there. It's usually on the inside, isn't it? Let me just find it for you. Or I'll put it on inside. Yes, here it is. So there's the ISBN number if you want to have a look in there. Okay. And that one is, it does say a 6-week program, but it's not. She does a lot of talk about how to prevent getting a hip fracture, because again, she says that 2 out of 3 hip fractures are women, and also that, I can't remember the exact percentage, but the majority of women will never regain their full mobility again after a hip fracture. And for some people, it can even prove fatal depending on the age they are when they get their hip fracture. So she's an orthopaedic surgeon. That's where she's coming into all of this. And she's postmenopausal herself. So what she's learned, she's bringing into the book and also then into her practice. And she's doing a lot of advocacy for women with osteoporosis, osteopenia, for what they can do for themselves, lifestyle changes, in order to try and help their bones and re-strengthen their bones so that they they negate the possibility of having a hip fracture. Not completely, obviously, but they can really reduce it. So yeah, so I'm taking my vaginal estrogen. I started on that a month ago. Huge difference in a month. I was getting up 2 or 3 times, maybe even 4 times in the night to urinate, to go to the toilet. That in the month came down to once a night, which is a huge difference. I also found as well that my sensations are coming back, hallelujah, so I'm happy with that, and that's all coming together. I didn't have the UTIs anyway, so I can't talk about that, but I think that that's all about it being preventative. So it's not necessarily going to cure a UTI if you've got one, but you need to be, that was one other shocking thing. They said that in America, if over the age of 55 they gave vaginal estrogen to every woman, and if they used it, they reckoned they could save something like 10 billion a year in the cost of treating UTIs and hospitalizations due to severe infections from UTIs in women. Huge difference. So that's amazing. So I've started on that. Now I have a pessary, so just a very small vaginal tablet, and I pop that in twice a week. I do want to try the cream as well, because instead of, because I think that would play a big part in some of the other symptoms that I've got, a bit of thin skin splitting and that kind of thing that I want to kind of address. So that's really helped. So if anybody wanted to have a go at trying that, then I really would strongly suggest it. And I think that it might even be available over the counter in the UK. Now in Spain and in America, everything with any estrogen at all in it, because of the Women's Health Initiative 2002, has got what they call a black box warning on it. There's a big bold outlined box on there that says, you know, taking this product can result in breast cancer, blood clot and heart disease. And there's a huge campaign to try and get that lifted, because that's all been found to be untrue. And that's all covered in this book here, the Estrogen Matters book, as to why it's untrue and all the details. I'm not going to go into that now, because I'm trying not to keep you here all night, as much as you know I like chatting. So that was the one thing. Oh, the other thing as well is that for loss of libido and for mood is also that women can take testosterone. And I've got some, when I went to the other thing is there's a hyperactive sexual desire disorder, HSDD I think it's called, and that's all to do with the vaginal estrogen, but then also to do with the testosterone as well. So I take a little bit of testosterone gel, just about as much as on my fingernail, and I put it just on my bicep, just a little gel, and just rub that in every single day. That's helped a lot with mood and how I've just been feeling about life. So that's really, really good. And a lot of the books go into the fact that a lot of women are prescribed antidepressants whilst they are in postmenopause, and that actually that isn't an effective treatment. It is for some people, and those that need it, it is. But also to look at the hormonal balances as well, not just presume that it's a clinical depression. So I take that. Then, because I haven't had a hysterectomy, then I'm taking patches. So I've got patches on my skin. So I just have a patch on my, it's not on my arm, I have it on my tummy actually, on my skin. And I'm taking the minimal amount at the moment, but I am going to ask her to increase it when I go back to the doctors again to try and get, I want to try and work with somebody to get me up to the optimal dose, because if I'm on the optimal dose, I will get the protection against osteoporosis, heart disease, dementia, type 2 diabetes, pancreatic cancer, colon cancer, macular degeneration. I mean, that's a lot, isn't it, to not have to worry, well, not have to worry about, but not hopefully reduce the chances of. And the patch I change twice a week as well. So I've just set an alarm on my phone that just says patch change, and then that just, I think I'm Wednesday nights and Sunday mornings. So that's the days I've got for my patch changes. And I also do my vaginal estrogen at the same time then, because that's twice a week as well. With the vaginal estrogen, they say use it every day for 2 weeks and then drop it down to twice a week. I think I could have done with slightly longer on mine than the 2 weeks, but you can't overdose on that. It's very, very difficult to overdose on that, if at all, because it doesn't actually go into your bloodstream. So even people who have had breast cancer, and I'm not a doctor, but what I'm hearing through all of these sources is that even if people who've had breast cancer can still use vaginal estrogen, because it doesn't go into your bloodstream at all. And the patches don't go through your liver like a tablet would do. A tablet would go first pass down into your digestive system and through your liver, and then out into your blood and the other receptors. So yeah, can you tell it's been a bit of an awakening, and it's been a bit of a strange time really to find out all of this information. Oh, that was the other, going off track. I also take progesterone, that's the other thing, because I've got a uterus and I'm taking estrogen. Then I've also got a progesterone gel, and I just put a little bit on my tummy, again about the same amount as I did on the testosterone, but that just goes onto my tummy in different places, and I take that every night as well at the moment. I might go back to cycling the hormones, but at the moment I don't know enough about that yet to know whether that's a thing or not. I've got to learn as I go along. But it's just staggering that we've been denied and we've been put off this type of treatment or potential treatment. Again, it's not for everybody, so you've got to decide for yourself. But I would, if any of this conversation has rung true with you, or you've gone, hold on a second here, this feels a bit similar to what I'm going through, then I would definitely go on to the menopausesupport.co.uk and download their symptom trackers and have a look at that and just see where that is. Have a look at the people as well who I've recommended. The other one that is really, really good is a lady called Dr. Felice Gersh, Gersh, I think. And again, I'll link her down below, because she also has got a very easy way of giving some very technical information, but in a way that you can follow. I'm not going to say you're going to pick it all up straight away and understand it all, but you can understand it at the end of the conversation that she has on these videos. But it starts to give you that baseline understanding of what's happening, because this is definitely a situation whereby there's a high chance that if you go to speak to your doctor about any of this, you will know more than they do, unless you can find yourself a menopause expert. The other person is a UK doctor called Dr. Louise Newson, and she's got a menopause specialist clinic. I don't know exactly where in the UK it is, but it is in the UK. So she's very good too. And there are other people as well. Once you start to look into it, it is all starting to come to the fore in terms of these symptoms, and that, so bringing the symptoms together so that we can actually see what it is as a complete thing. As I say, I was completely in the dark as all these things were connected. And then once you've got that, it's about education in order to understand how you might be able to access treatment if you want to, whether that's hormone or whether it's more of a natural therapy, or whether you are happy with your status quo and that you're not comfortable taking anything and you don't want to. Just put it on your radar so that at least you know that if you were having some troublesome symptoms, that you don't now have to run the risk of breast cancer, blood clots and heart disease in order to access some treatment for those, because that could be huge for some people as well. It's been a lot. It's been a huge amount. And as I say, that there has been times during this last couple of months where I've actually felt really quite cross that I just didn't know any of this. And then I felt sad that, you know, I mean, I probably for 10 years plus I've not properly slept through the night. And the stress that has on your body. And then all the other things that come in that make you question your life and what you're doing. And they're even reckoning that there's one divorce lawyer who said to one of the doctors when she went to one of the seminars that she thinks that quite a lot of divorces around this time of life are down to hormonal changes and not actually down to the fact that we fall out of love with our partners. I mean, obviously some are. I'm not saying that they're not. But dissatisfaction with life, that loss of joy that we spoke about, and that questioning, that desire to have time to yourself and to shut yourself off from things that you've always previously enjoyed doing, you know, that could open up a whole new world for a lot of us, couldn't it? In, you know, a lot of positive experiences for us that we're just shying away from at the moment. And I don't want us to be shadows of ourselves. We can put on an illusion for a YouTube video, and I can use my sewing as a crutch. I can shut the door and shut myself into my sewing room, and I can do lovely videos, hopefully that you enjoy. And I certainly enjoy making the videos for you and then interacting with all the people that I do. But I just felt I would be doing a real disservice to all of you that watch my videos if I didn't share some of this information that I have now learnt and that has come to mind. So I'm going to thank you very much for bearing with me. A, because it's off topic. B, because I've talked about a lot of personal stuff that you probably didn't want to know or didn't care to know, but again I felt was all relevant. I have got a checkup appointment with my gynaecologist next week, so I will be talking about increasing my HRT in order to try and get me up to optimal levels. I'll also be sharing with her that it was a good job I had my DEXA bone scan, because actually if I'd waited until 65, I probably would have been at risk of fracture by that point, judging just where I am on the scale now, certainly in my back, never mind about in my hips. And that hopefully now with that knowledge, and with the help of books from Dr. Vonda Wright here, Unbreakable, if I can incorporate some of these practices into my life, then hopefully I can either slow it down, or I can sort of stop the decline, or I might even improve my skills if I'm really diligent, but I don't know if that'll take me away from too much sewing. So we're going to have a life balance here. But at least I know where I'm at now, whereas I was completely unaware before. And that really concerns me, that somebody else that I love and care about, you guys, might not know any of this. Certainly with the vaginal estrogen and the UTIs, that is huge, 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 huge information. And so, yeah, I wanted to share it with you. I'll try and wrap it up really quickly. Thank you so much for your time. Sorry that this is completely off topic, but I hope you see now why I think that actually it is relevant to my followers, my subscribers. And I hope that it gives you some information and spikes your curiosity in order for you to start and look at some of these things for yourself and make your own mind up. If anybody wants a conversation about it, I'm very happy to have a conversation about it and to have a chat. Obviously, I'm not medically trained in any way, shape or form. I'm just the same as you and I. But I'm learning enough to know that there is a need for us to advocate for ourselves, because not once at any gynecological appointment has anybody said to me, "How's your sleeping, Claire? How are you finding that? Are you getting up in the night to go to the toilet? What about your desire for having sex and for being active and just enjoyment? How's that all going?" Nobody ever, in the UK or in Spain, And that's what I think should be happening now, in order that people do know that there are all these unrelated symptoms, that if we knew about it, we could join the dots together and we could make an informed decision. And who is it who said it? One of the doctors said it, that said it's really strange, but when I give my patients information and education, they make really good decisions for themselves. And that's where I think we're at the moment. And if I can remember who did it, I'll pop it down below in the description as to who wrote that. But because that is spot on. And I'm trying to make good decisions for myself, for my longevity and for my future. And I wanted to share that with you just so that you could do the same if you wanted to. Anyway, this video comes to you all with lots and lots of love from me. Lots of hugs, kisses, and I hope I've not upset anybody or concerned anybody. But I just wanted to share what I'd learnt, so that you too can be on the same page if you want to be, and you can ignore it if you want to. That's absolutely up to you. But yeah, knowledge is power, I reckon. And together we're all going to be stronger. So lots of love to you all. Have a great evening or day, whatever you're doing. And I will see you all soon with some more sew along videos. Take care, everybody. Bye.